4, 3, 2, 1, go.
This skill is designed to evaluate your ability to properly immobilize a closed, non-angulated, suspected long bone fracture. You're required to treat only the specific isolated injury. The scene survey and primary survey have been completed, and a suspected closed, non-angulated fracture of the right tibia distal to knee is discovered during the secondary survey. Continued assessment of the patient's airway, breathing, and central circulation is not necessary in this skill. You may use any equipment available in this room. You have 5 minutes to complete this skill. Do you have any questions?
No.
Whenever you're ready, you can go ahead and begin.
Okay, so I'm wearing my BSI, my gloves, and my eye protection. I'd like to direct my assistant to manually stabilize the patient's right leg. She's got a right tibial fracture just distal to the knee. And I'm going to check the CMS distal to the knee. So does the patient have a good distal pulse? She does?
Yes.
Okay. Can you wiggle your toes, please? And you can feel me touching? Okay, so she's got good CMS distal to the side. Let me measure the splint here. Measure it against the uninjured leg, and that looks good. Warm it up a little. Now pat it. Okay, and let's see, let me go ahead and I'm going to slide this under that. So as best as you can, we'll kind of replace your stabilization with mine. Okay. You can just gently slide your arms out when. Okay, go ahead. Okay, we'll gently. If you can just put your hand right under. Yeah, there you go. And let me get this all worked out here. So I've got her foot in a position of function. I'm going to go ahead and stabilize the splint in that position first. Okay. And now I'm going to secure the splint. A variety of methods. Okay, let's try to minimize the movement as best we can. If we had an ice pack, which we don't, I could have applied it to the break, but we don't have one here with us. So that's one way of securing, and then I'll use a cravat. A couple of other places. Placing the knot over the cardboard area. How you doing?
Good.
Okay. Applying the splint here to help immobilize your leg. We think it might be broken, so the less it moves, the less pain you're going to have and the less injury you're going to experience. The splint comfortable for you?
Yes.
Feels like it's pretty well secured here. Got her foot in the position of function. I have access to her toes. Do I feel a good dorsalis pedis pulse?
Yes.
Okay. Can you wiggle your toes? You can feel me touching?
Yes.
No numbness or tingling in your foot or around your leg? Okay. The splint feels secure on your leg? Okay. I believe we're done with the skill station.